on the cervix. The cervix is the part of the mouth of the womb.
Okay.
So it happens when the normal tissue become abnormal.
Okay.
And then it grow faster and it became, it become something which is called a tumor.
Okay.
So that tumor is the one that we call it the cancer of the cervix.
All right. So, doc, hey, people are probably, yes, but we didn't know the womb has a mouth. Like, wow. So it's not necessarily in the womb.
It's not necessarily in the womb.
Okay.
It's on, on the mouth of the womb. The mouth of the womb is the one that opens. We know that the womb is the one that carries the baby.
Yes, yes.
And then, it closes for 9 months. After 9 months, it opens up, and then it's where the baby, go through, so that we can have a beautiful baby.
All right.
So that's where the problem, starts.
Okay. Now, doc, please, can you tell us who gets cervical cancer?
Thank you for that question. That is the most important question. So, cervical cancer. People who who get it, the people almost who are, let me say, sexually active women.
Okay, sexually active woman.
Yes, and then basically, the cause of the cervical cancer is HPV, human papillomavirus.
Okay.
Right, which is a more of a sexual transmitted infection.
All right.
And then everyone who's sexual active is at high risk of getting this HPV.
Okay.
So then, but there are other people who are prone or who are at high risk of getting this HPV. People who have got, who start, love making at the early age.
Okay.
Like before 16 years.
Oh, so people that started having sex before the age of 16 years or babugel. Yes, doc.
And then people who have got multiple partners.
Okay.
So they are at high risk of getting the HPV.
Doc, please, what is multiple partner? Okay, is 2 partners multiply? What constitutes multiple partners?
Anything more than 1, it's multiple.
Anything more than 1. Siyeza babugeli emakaya. Uthi udokotela akunakuthi because by 2 when ungcono kunalo omunye ona by 3. If it's more than 1 multiple partners, it is a risk factor ukuthi uthole cervical cancer.
And then the other people who are at risk is people who are smoking.
Oh, smoking, doc.
Yes.
Oh, wow.
So if you smoke, you are at a high risk of getting the HPV, which will cause to have, cervical cancer. Okay. And some people who are having, who are taking oral contraceptives for more than, some studies says that more than 5 years, some studies says more than 10 years. So if you are continue to take oral contraceptives, you are more likely to be at risk of getting cervical cancer.
Wow. Doc, that is a very deep one because, a lot of women are actually on oral contraceptives, and this might be confusing. Okay, so what should I stop taking these oral contraceptives? Because, I wouldn't want to get cervical cancer later.
No, you should not stop taking oral contraceptives. But as you are taking them, then you have to come to us or you go to the clinic, then we have to screen. Okay. Because it's a disease or it's a cancer that can be preventable.
Oh, okay. So that is actually good news that it can be preventable. So, Doc, now with his screen, what do you mean? How is it screened?
Thank you for that question. So, screening, we are talking about that in the community, people who are not sick. Okay. They come. Yeah. When they come, and then we check that, are they at risk of getting this cervical cancer? So then they come and we do a pap smear. Okay. So a pap smear, we take some cells on the cervix, the mouth of the womb, and then we take it and then we send it to the laboratory, and then they check whether it's normal or it's abnormal. So When it's normal, then it's okay. You can come back after 3 years. But when it's abnormal, we have to deal with it.
Okay.
Because, I mean, in 5-10 years' time, it will become cervical cancer.
Sure. So, doc, who gets screened? Now, Umbugele Makaya is wondering who can get screened?
Every woman who's sexually active must get screened.
Okay.
Women from age of 25 years old should get screened.
Okay.
But those who start, sex early, they must get screened at least, at the age of 21.
Okay.
So you go to the clinic and then they do the pap smear, and then they will explain to you that your results is either they are normal or they are abnormal.
Okay.
So in this category, only there are other people who are at a high risk, like people who have got HIV, who are HIV positive. So we need to screen them more often.
Okay.
Each and every year, we have to be screening them because they are at a high risk of getting HPV, which will cause cervical cancer.
Wow. So, Dokotela, so anyone, like if you are sexually active or, you know, as you mentioned, if yena, they can just go to the clinic and they can actually get this pap smear done.
Yes. So basically there is a program in our country.
Yes.
That in the lifetime of a woman, you must at least, get, 3 pap smear. Okay. At the age of 30, and then thereafter 10 years.
All right.
You screen again. And then another 10 years, you screen again. And then you can stop screening when you are at the age of 65. Okay. So that's when you can stop screening. Okay. We're only talking about people who are only having, who doesn't have HIV. Okay. Okay. But those who are HIV positive, they need to screen more often.
Babugeli Amakaya, I hope ukuthi nikuzwile lokho. Uma usuqalile and you are sexually active, it is very important ukuthi you actually go to your clinic, go to your nearest clinic and get screened. And then also futhi ke, if nawe ke mhlambe awukho ke kulapho, please, and you may be at risk, uwashilo udokotela what are the risk factors, please, please, please go and get screened. Uthi udokotela, it is actually preventable, and we know ukuthi prevention is better than cure. Now, doc, please tell us ukuthi nakho ke one now has cervical cancer. How does it present and when does it present?
Okay, as I said that we need to be screening people. That's where mainly we get the abnormal cells. Okay. But there are those people who are now have got the symptoms. All right. So now it means that you have a cancer. Okay. Which is an invasive. So then you will, when during the between the period, you see spotting or you see blood.
Okay, so one between the periods, they see spotting or blood. Okay.
Yes. Yes. So then it means that they need to go to the clinic. Okay. And then at the clinic they will assess them and make sure that they don't have the problem of the cervical cancer. All right. Or when you are making love and then you start bleeding. Okay. After making love, you are bleeding, then you need to be concerned. All right. Or when you have got discharges that are, increased or that are more. Okay. Then sometimes they are smelling. Then you need to be concerned. You have to go and see the sister or see the doctor. Or people who are over 55 and they have stopped the menstruation and now they start seeing their periods. Okay. And then they have to be concerned and then they come to the hospital. Then we can able to help them.
All right. Wow. Udokotela mentioned 4 important things, and ngizocela ukuthi siziphinde just so that uma ngabe wena lapho khona ekudlulile we are going to quickly repeat them. Doc, you said ukuthi if you are older than 55 and you are bleeding.
Yes.
Like after, yeah, so after menopause and then baya bleeder, right?
Yes.
Okay. And then udokotela futhi wakhuluma ngokuthi if like during sexual intercourse you are bleeding.
Yes.
Okay, so that is, you must go. And also utena in between the periods if there's also some spotting. All right?
That's correct.
Okay, and then udokotela wakhuluma nge-vaginal discharge, and udoctor, very important babukela makaya, azange athi uma uni-discharge, uthize uma i-abnormal, uma ngabe iyinenge and futhi ingasanuki kahle, inephunga elingasi kahle, then please go to your clinic and actually get tested. Now, Doc, okay, you told us how it presents, and can anything be done?
Yes, it can be done. If you go to the clinic, and then the clinic will refer you to the hospital.
All right.
And then in the hospital, then we'll have to check you. So it's important that you present early. So if you present early, then we can do something about it.
Okay.
That is very much important. So what we can do when you present early, and then your pap smear is abnormal, then we can do something called a colposcopy.
Okay.
So a colposcopy, it's a microscope where we see through, on the mouth of the womb, and then we see the abnormal cell. And then those abnormal cells, we can cut them and we remove them. And then we send it to the lab, and then the lab will tell us if there is a cancer which is invasive. Right? Doesn't mean that if you have got the most important thing that you have got, if you have got abnormal cells, doesn't mean that you have got cancer.
Oh,
it may
okay.
mean that you are at risk of getting a cancer.
Oh, all right. Okay.
Yes.
Also, Dokotela, if, wow, Doc, please can you repeat that? Because maybe Vela Omunye was thinking, good, okay, so if I've got abnormal cells, it equals to cancer. Agusi kanjalo. Yes, Doc?
It just only means that this, abnormal cells, it can progress and then it become cancer. So it means that at that stage, you are still, we can still do a lot about it.
Yep.
As I said, that we can remove them. It's called a lead. We remove it and then we send it to the lab. The lab will tell us that you have removed everything or you didn't remove everything. So if we didn't remove everything, we can do the procedure again.
Okay.
And then if we have removed everything, then we can follow you up with a pap smear.
Okay.
And then after 6 months and check. And it can come back, says that it's normal, then we are all happy. If it comes back that the abnormal cells are still there, then we can sit down with you, and then if you have completed your family, you have got kids, you are sure that you don't want to have more kids, then we can able to do a procedure called a hysterectomy, which is a removal of the womb, and then we remove it, so that can prevent that those abnormal cells to progress to become cancer.
Oh, okay. Wow. Hey, babukela makaya, niyaluza ulimi luka George kunzima ngentshelela ngathi siphethe i-powerhouse wena boma colposcopy hysterectomy kunzima. Khumbulani ukuthi we are here to teach you so that you know more about your health. Kanti futhi siyakhumbula ukuthi health is not just, your health is not just an individual thing ukuthi eyakho uyi-one. Your health, others' health, sonke. It is literally, if you are okay, you can take care of another. Kanjalo kanjalo isizwe sethu siyaqhubeka siyaphila. We are talking about yona cervical cancer. Now, Doc, please tell us, from what you have seen in our country, abobani like that please do talk about age, talk about race, ukuthi, abobani that are like, more likely to present with cervical cancer.
Okay, in countries like ours, the cervical cancer, it's at a higher rate.
All right.
What does it mean? That it means that 7 women out of 10 are at the high risk of getting HPV.
Okay.
Right?
7 out of 10.
7 out of 10, because you know that it's a virus that comes from, I mean, people making love. So then when it gets through, then almost 7 out of 10 can have, I mean, HPV. And then 1 out of 26 women will have, I mean, cervical cancer in their lifetime. Right? So in the statistics, like in 2017,
Yep.
they found that, I mean, almost 7,000 women in South Africa had cervical cancer. Right? And each and every year, 4,000 women are dying because of cervical cancer.
Sure.
So women should not be dying. Women should not be dying, because this is a preventable disease, and I mean, this cervical cancer comes slowly and slowly and slowly. So people who are at risk, people who are from the age of, I mean, 35 and above, as I said, that it takes time. Like if, like, I mean, started as abnormal cells today, and then after maybe 10 years, then it can become cancer. So if, like, today you're 25, so then we'll look at the next 10 years. When you are 35, you could be having cancer. Right? So those are the women at risk. I mean, black women, they are at risk.
Okay.
And then the other people who are at risk, that, I mean, if your social circumstances are not good, you are more likely to be at risk of getting this disease.
And doctor, why is that so? Like, why is that so? Why, if you come from a background of a low socioeconomic status, that would put you at risk?
There's no particular theory about that.
Okay.
But as we know that, I mean, if your social circumstances are not good, I mean, you don't eat healthy, and then some of our sisters in those communities, that they will end up falling in love with older people, just to make, I mean, to put a bread on the table. So we cannot judge them. That I mean, most of our circumstances are bad. So that's, you know, that's what I mean, those are the speculation that, I mean, they are saying that if you are poor, you're more likely to get it. And then the other thing that you find that if you are poor, you're not going to go and screen and all those things, because you might not have money to go to the clinic. You might not have money to do pap smear. But the most important thing, that pap smear and all these things are free at the clinic. You can do them for free.
Babugeli, please. Dokotela, you know, you can go to the clinic and you can get this done for free. And this is very important, because uma ngabe kuna anything engekho right, from the moment they pick it up, you know, something can be done. Yazi, we know ukuthi people perish because of lack of knowledge. Kanti-ke, we just want you to know more, so that you can actually do something about it. Yazi, kunzima ukuthi wenze something ngento ongayazi. Kanti uma usuwazi kulula-ke ukuthi ukhona ukuthatha inyathelo phambili to actually do something about it. Now, Doc, can you please tell us, how can it be prevented?
Okay. It's simple.
All right.
That, I mean, we must encourage our girls not to start having sex at an early age.
Okay.
They must wait. You know, in the Bible says that, I mean, sex before marriage is a sin. So you have to wait a little bit by the time we are matured, right? And then the other thing, that stop having, I mean, multiple partners. And then the next thing is that if you are engaged in sexual activities, you must use a condom, right? And the other thing that is important, that there is a vaccine for that, right? There is a vaccine for that. So this vaccine, we can give them from, to the younger girls from the age of 9, right, until the age of 26.
All right.
Right. So there are 3 types of vaccine.
Okay.
And then there's Gardasil and Gardasil 9 and Cervical.
Okay.
Right. So then these vaccines, they are looking at they have got the 2 main type of HPV, 16 and 18. And then that's on Cervix. And then Gardasil has got four types of HPV inside, which is 16, 18, and 6 and 11. Whereas the Gardasil 9, they have included the other 5 that can also cause the cervical cancer. But the most important ones are those, the 2, 18 and 16 and 18.
Okay.
So the young girls can get the vaccine. In 2014, there was a program that the government was giving vaccine. I think they have gave almost 350 grade 4 learners in 4 provinces. That was Gauteng, our province, Mpumalanga, Northwest, and then KwaZulu-Natal.
Yep.
And then almost 80%, it's around 350 people got the vaccine. And then the problem with the vaccine is that at the moment it's expensive. You need to get at least 2 doses or 3 doses, but it's expensive. 1 dose is around 650 rand.
Yeah.
So most of our people cannot afford. So we are hoping that the government will give this for free, like the other vaccines that children are getting. We know that children are getting vaccine for measles and all those things, and then if it can be included at the age of 9, it can be included. Then we can save the future. We can save the young generation.
Wow. Yeah, that was really a mouthful. Now, Doc, we've already gone through the vaccines. Omunye may be wondering, okay, kahle kahle yini i-vaccine? And secondly, yini umsebenzi we-vaccine? When I've gotten the vaccine, does it mean I'm safe?
Okay, a vaccine basically I'm not sure how to put it in a lame time. Basically, there is they want your body to have some antibodies so that when you get the infection, then the body can able to fight.
Okay.
Right. So then we are introducing that antigen, that HPV inside you, so that when you have got an infection, it's like if you have got a flu. Then next time when you have got a flu, you may not have flu for 5 days. You will only have for 1 day because your body can be able to recognize that that is the flu and able to fight. So that's what the vaccine comes in.
Okay.
So then by the time you are infected, then it's able to fight that virus, and then after that, then we can be doing the pap smear and then checking, making sure that you are safe.
Okay, so Doc, umuntu magati, okay, I got the vaccine, so I can just go and galavant. It doesn't work like that.
No, it doesn't work like that. It just means that you must be able to still practice safe sex.
Yeah.
You have one partner and then continue with the pap smear.
Okay.
On the program so that we must make sure that you don't have that. So it doesn't mean that it's for free, then you can have multiple partners, have whatever. But still, we still need to make sure that you screen.
Okay. Now, Doc, the next question we want to know, if there was someone, let's say, here's a girl, umamake had the cancer, does that mean guti naye uzoba nayo?
Not really.
Okay.
I can put it this way, that as I said, that the HPV is almost a sexual transmitted disease.
Yep.
But in some family line, there are some families that, I mean, you find that they are like, they are more, you know, their bodies are more susceptible to the HPV.
Okay.
But doesn't mean that, I mean, if your mother had a cervical cancer, then you will have a cervical cancer. But if you're practicing, I mean, you have multiple, I mean, partners, and then you started sex very early, and you're smoking, you're most likely to have it.
Wow, babukeli, siyacela ukuthi nizwe kanti futhi ningagcini ngokuzwa bese niyenza lezi zinto udokotela azishoyo. Let us not just hear them, but let us actually, you know, practice them, because kanjalo sizobe sizisiza thina. Now, Doc, the next question that we would actually like to know is, so yes, you have it. Like, what is the prognosis? How bad can this can cervical cancer actually be?
Okay, so it depends on the stage.
All right.
That
so there are stages to this thing.
Yes, there are stages. That,
okay.
So we have got 4 stages.
Okay.
Right. We have got 4 stages of cervical cancer. In those 4 stages, we've got stage 1, stage 2, stage 3, stage 4. As you can see, the numbers are going up. So it means that, I mean, on those stages, I mean, it depends, because remember, I mean, the cancer, it starts from here, then it spreads.
Okay.
That's the problem with the cancer. So in stage 1, it means that the cancer is still there on the mouth of the womb.
Okay.
Right? So in stage 2, then the cancer has moved beyond the mouth of the womb. Then now it gets into the womb itself. Right? So in stage 3, then the cancer has gone beyond where it goes to the pelvic wall.
Okay.
On the side.
All right.
So stage 4.
Yes.
It's stage 4. It means that now it has gone into the bladder. It has gone into the rectum. So you find that now, I mean, you can just be, you know, you cannot control your urine. It just come on its own, and then you cannot control number 2. It just come in on its own. So that's when it's bad.
Okay.
So in stage 1, we can able to operate.
Okay.
And then we do the operation.
Okay.
We do a bigger operation, which is called a radical hysterectomy.
Okay. Dokotela, what is a radical hysterectomy?
Okay, so a radical hysterectomy, we are removing the womb.
Oh, you are removing it.
Yeah, removing the womb, but
okay.
we're not only removing the womb
yeah.
only.
Okay.
We're even removing, I mean, the part of the womb that is, I mean, other parts which is, I mean, next to the womb. And then we are also removing even a small part of the vagina.
Okay.
So why are we doing this? That we have to remove the cancer, everything out.
Okay.
Right? So that, I mean, you can be cancer free.
Okay.
Yes.
So if you were caught in stage 1 and you were treated in stage 1, you can be cancer free.
You can be cancer free.
Wow. Okay.
Right? And then from stage 2 upwards, we can use radiotherapy.
Okay.
So a radiotherapy is like an X-ray. We put you inside the X-ray machine, then that X-ray, it kills all the cancer cells.
Okay.
In the pelvis. And then if it has gone beyond, it's in stage 4, that's where the problem is, that now there's not much that we can do. Right? We can give you a chemo. So a chemo is a drug that can, you know, kill some of the cancer cells. But in stage 4, because it's gone beyond what we can do, we cannot remove all the parts of your body. You are not going to live. So we're just going to at least make sure that you have got, your life is comfortable. Right? So the prognosis that in stage 1, almost 100%.
All right.
Right, in the next 5 years, it will still be, you know, if we have done that operation, in the next 5 years, they will leave.
Okay.
So in stage 2, then that, you know, the percentage still, I mean, goes down, almost around, around 60%. And stage 3, around 50%. So above stage 4, and then few people are going to live in the next 5 years. So the program is like, in the next 5 years, are you going to still be alive? So that's what the prognosis. But if we catch it early, and then we have prevented it, then you can live beyond the 5 years.
Sure, Babugeli Emakaya. You know, this is very, it's really, it's real. It is as real gets. The fact that something can be done, 1, 2, your life can be saved. Asingavumi to succumb to something, whereas kukhona izindlela yokuthi ingatreatwa. Doc, we just want to know now, you know, you've got cervical cancer. Let's say umbukele makaya uyazi ukuthi, okay, I've got cervical cancer. They told me ukuthi it's stage 4. You know, should they now prepare ukuthi they going to die?
Okay, the matter of life and death belongs to the Almighty.
Yes.
So we don't know, when, someone is going to die. Someone might have a cancer today, and I might not have a cancer today, and I can die before that person. But if you are in stage 4, because there's not much that we can do. We can able to control the pain, because it's painful.
Okay.
We can able to control the bleeding by giving you a short dose of radiation, and then we'll give you more painkillers, like your morphine, that are, have got, stronger than the Panado.
Okay.
And then in our culture, we cannot send people to, we don't want to send people to, hospice. Hospice is a place where, people who are ill, who cannot able to take care of themselves, they can be there, and then someone like a nurse can be looking after them. So, and then if the family agrees, we can send you there, and then the doctors can come and check that, make sure that, your life is comfortable, right? But because it has gone beyond, within 6 months or a year, we may talk something else.
Ish, that is a heavy one. Babugeli emakhaya ngiyacabanga ukuthi siyezwa kanti futhi siyazwisisa ukuthi into ebalulekile kakhulu ukuthi i-preventwe kahle, because you do not want to find yourself so ukuthi you have cervical cancer, and because it can be prevented, let us do just that. Asiphakameleni ke kanti lento. If you have the risk factors, please ushilo dokotela ukuthi it is free in the clinics. Let us use it to our disposal. Now, Doc, please, can you elaborate maybe more on other complications of cervical cancer? Can it also come with other cancers, or it's just complications associated with cervical cancer?
Thank you. As I said before, that cancer, it spreads throughout the whole body. So if it's on the advanced stage, like stage 3, stage 4, then now the complication, you might have infection on that tumor, so then you start to have an infection there, and then you might start having, as I said, not be able to go to the toilet, right? And then you might start having things like the urine is coming on its own, then you are wearing diapers, right? And then you might start having that number 2 is coming on its own, it's also you are wearing diapers. So those are other complications that can happen. But there are some of the complications that can happen after we've done the operation. The operation for the one that I said is radical hysterectomy. It's one of the biggest operation the gynecologist can do.
Okay.
That's why I needed to go back and super specialize to know how to do that operation because you deal with the imported structures and then so what can happen sometimes that we can while we are doing the operation, some of the things can instead of like when we are operating removing the cancer and then even touch the bladder, but we can able to fix that.
Okay.
Right? It's not a problem.
All
because
right.
we have been trained to do that. We can able to fix that. Right? And then the other complications can happen that with radiotherapy. So if you have got a higher stage like stage 2, stage 3, and then we give you a radiotherapy, you may find that because that radiotherapy is like if someone has got burned with water or fire, there's that scar that you see. So even inside there's that scar.
Okay.
So you may not be able to make love well, but we teach our patients that if you are unable to make love, then you can use a KY jelly, right? And your partner should be gentle. And then sometimes, because of the radiation, you may find that, when you go to the toilet, you see a little bit of a blood. That we can able to fix it. We can, send you to a place in Cervical where they can put you inside the oxygen, then it can get fixed.
Okay.
Right? So those are some of the complications that can happen after you've, we have made a treatment, we have given you a treatment. But the most important thing is that, we want to give you a treatment so that we can live. I know of the patients who have, lived more than 10 years after they have got the cervical cancer. So that is important. It's not a death sentence. Then we can able to help you. If you have it, we're able to help you come to the hospitals, and then we can able to do the operation or give you radiotherapy for the people who have got a higher stage. One thing that I want to mention, why are we giving radiotherapy for the people with higher stages? Because as I said in the beginning, when we do an operation, we want to remove the cancer away.
Yeah.
So if it's a higher stage, you may find that when we do the operation, this cancer is still there. That's the question that we normally get when I'm in the clinic, that our patients say, no, just remove this thing. If it has gone beyond stage 2, we cannot remove it because, even if we remove, the cancer is still there. And you still have to go and get radiotherapy. And then people who have got 2 treatment, they don't do well. Right? Because we have removed it, and then with the operation, then we give you radiotherapy, and then all those, side effects, they come to you. So then we cannot do that. We'll send you to radiotherapy. They give you radiotherapy, and then you'll be well. For 5 years, I can guarantee in the next 5 years, if you get the treatment, then you'll be well. And then from year number 6, then we know that God is good.
Definitely. Wow. Babukeli Amakaya, I hope ukuthi you are taking in a lot, and siyacela ukuthi ingagcini la kuwe, wena mosuwazi tshela nabanye, wena musufundile fundisa nabanye, wena musuzwile batshele nabanye ukuthi no man, but ize clinics yakhona ukuthi siyenza ama pap smear, and ama pap smear amahala asambeni. Take responsibility of your health. Bakhona abodokotela bafundile bayazi ngalokhu, asibasebenziseni. Doc, one of the questions I am actually getting here, but again, because HPV, you said that it's sexually transmitted. HIV, you can test, males and females can test. Can males test for HPV? For example, if you know this person is HIV positive, obviously you wouldn't want to, contract the disease. You can actually prevent and use protection. Can you test for HPV in umuntu wesilisa specifically?
In male, even male, they have the the HPV.
Okay.
They can get the HPV because, as I said, that it comes when you get contact. With someone who have got HPV.
Yeah.
They can have HPV. We can able to test that. HPV. You do. HPV testing.
All right.
So then we can able to test that. And the other thing that I maybe have forgotten to mention that on the vaccine, some other countries they also give the boys.
The males, okay, yes.
Yeah, they also give the boys from the age of 15, between the age of 15 and the 26, that vaccine. That it prevents.
They can get.
Yes.
Okay. Now, Doc, another question. If you are over the age of 26, does it mean all hope is lost for you? Umuntu cannot go and get the HPV vaccine?
Not necessarily. The reason why, they are saying that you must get it as early is that because during that age, you have not yet, started having sexual intercourse.
Okay.
And then people who are from the age of 26, it means that they have started having, making love at the, for a long time. So and then getting that vaccine, it has no less effect than the one who started early to get the vaccine. So yes, they can get it until the age of 45.
Okay.
But it's if we start with someone at the age of 9 and someone ages of 26, the one who will be more protected is the one from the age of 9.
Okay, so the sooner the better.
The sooner the better.
Wow. Babukeli emakhaya, I hope ukuthi siyezwa and futhi you are noting all of these things. Kanti ushilo udokotela ukuthi ngempela the vaccine, yes, it is quite expensive, but definitely it can save your life. Now, Doc, please, as we're going to be wrapping up this show, what would be, your last words pertaining to cervical cancer and umuntu what they can do?
Thank you. Cervical cancer, it's a preventable disease. You don't have to die because of the cervical cancer. You need to make sure that you get screened. Go and do your pap smear. If you have never done a pap smear, go and do a pap smear now. And then if the pap smear is abnormal, then they will send you to us. And then we can make sure that, we remove those abnormal cells. If you are diagnosed with cervical cancer and it's still early, we are happy to do, the big operation, remove the cancer, remove the womb, and then you will be fine. If you are at the advanced stage, the hope is still there. We can send you for radiotherapy and they can give you radiotherapy and then you will be fine. And then the last thing, that don't die of the cervical cancer. Let's stop the cervical cancer in South Africa. And then let's make the awareness that each and every woman out there need to go and screen and do a pap smear. At least 3 pap smears in your lifetime. If you are HIV positive, do it more often each and every year.
Wow, that was amazing and that was perfect. Ngindlela udokotela ashilo angeke ngisaeda or ukuthini ukusho wakubeka kahle. And I would like to challenge you Mbukeli emakhaya, if you are at the age of 40, asenze nje an example, if you are at the age of 40 kusho ukuthi ngabe so wenza ama-pap smear ayingaki ayi2 because bekumele iwena uyenze una 30 enye uyenze una 40. So please, if ungakaze uyenze asiphakame siphakamele lento, go and get your pap smear. You do not have to die nge-cervical cancer. Kanti ke kwithina on our side siyabonga kakhulu ukuthi nihlalile nathi nalilalela lelu hlelo. Remember, we want you to know more about your health because at the end of the day, your health is your responsibility. Singakhohlwa futhi ukuthi we are still in the middle of a pandemic, so it is very, very important ukuthi sifollowe konke ekumele ukuthi sikwenze. Social distancing, it is very important. Sanitize, and sanitize. Ungakhohlwa ukuthi ngaso sonke isikhathi wherever it is la oya khona, please put on your mask. Asinakekelaneni. Remember, you need to take care of yourself. While you are taking care of yourself, while you are following all of these precautionary measures, you are also also saving the person right next to you. Dr. Ndode, please, sicela ukuthi uvalelise ababukeli emakhaya.
And na cancer, God never failed ministry. For Mwamin Rambine, na cancer to the host. Thank you very much. And then to all people at home, God bless you. The blessings are coming to you. Amen.
Amen. Thank you so much, Dr. Ndode. Ukuthi uze lana uzosifundisa siyabonga ukuthi in your busy schedule usiphe this opportunity and then uze ufundise ababukele emakhaya. It was great having you. Siyabonga kakhulu on our side from Holistic Healthy Living. Ayigakacabananga asihlangane futhi ngeviki elizayo where we talk more about women health. Siyabonga.